Halftime is brought to you by Tria Orthopedic Center. For the athlete in all of us, there's Tria.
We are at halftime of the AA championship game. Caledonia up 7-0 in their quest for a four-peat. Barnesville doing a nice job hanging with one of the most dominant high school football teams in the country. Chris Long back with you here, field side at US Bank Stadium, joined by one of our many partners from Health Partners. It's Dr. Vanessa Burton. She's a dentist and chief of professional services with Health Partners. Talking teeth here. What is the protective value? We see football players always have to, they're told you got to wear your mouth guard. What's the protective value there?
Yes, so mouth guards are very important for injury prevention. The main thing is that a well-fitted mouth guard can really prevent from the most severe kinds of mouth injuries, not just to the teeth, but also to the lips, the gums, the bone, and new research is showing that it may even help with some concussion prevention.
Like a shock absorption.
Shock absorption, yep. Yes. So what we know is that custom mouth guards are really going to be kind of the key in terms of helping to prevent these main injuries. They're going to be covering those areas that need to give the best support. There's great boil and bite systems that you can find over the counter too. So I have an example of one of them that works really well also if someone is going to be hit. So what we're trying to prevent is not just a tooth from breaking, but maybe a tooth from actually like coming out of the mouth, or again, possibly concussion too.
Protect that smile and the brain. How often, if you're wearing mouth guards, how often should you replace them, whether it's wear or sizing?
Yeah, and that's really the tough thing. There's not really a standard as to when a mouth guard should be replaced. The main thing with that is going to be kind of the fit and how is it feeling in the mouth with the thickness. There's an ideal thickness that we want, and how the mouth guard is at the very beginning of a season or when it's first made, that's going to be kind of the thickness that you want. So if a mouth guard is looking thin in an area, or we see players on the sidelines or during huddles chewing on their mouth guards, the mouth guard's going to wear down a lot faster, so they might need to get that replaced more. Or if someone's going through tooth loss, so their baby teeth into permanent teeth, that way too they might need to change it out more often. Someone who has braces, they'll need to get that changed out more often also. So really it's kind of that thickness and the fit of everything, but keeping it clean, that's important. Just keeping it in a case also, making sure that your dog doesn't get it, that's always a key.
A couple cases and a couple examples of some of the mouth guards here on the set. All right, so worst case scenario happens, you lose a tooth or you have some significant damage. What should an athlete do to react to that?
So main thing is going to be call and try and get in with your dentist as soon as you can. Unfortunately, most of these games are happening after hours, on the weekends. Dental offices should have some type of like emergency contact so that if something does occur, you know where to go. But we want you to keep the tooth moist, whether it's a chip or the tooth comes out. Put it in some milk, put it in some contact solution, even spit in a cup and keep it that way. As long as it's lubricated, that's going to help us do our job. Kind of the worst case scenario is, someone wipes the tooth off, wraps it up, or comes in 3 days later and goes, here's my tooth. So the sooner the better. Main thing is just wear that mouth guard, help protect those most severe injuries.
Take care of those teeth. All right, Dr. Vanessa Burton, dentist and chief of professional services with Health Partners. Thanks for your time. We appreciate it.
Thanks, Chris.
Caledonia 7-0 up on Barnesville here at halftime of the AA title game.